Hello everyone, my name is KALAMA from the Department of Nursing in Near East University, and today I'm going to talk about the nurse as an instrument of healing. I'm going to present on behalf of my Group 2 representatives. My talk is very important for everybody, either young or old. My topic is most significant for you because you deserve good health and a good care provider to live healthy as a human being so that you can run your today's life. I'll start off by introducing the topic, defining it. Secondly, I'll talk about roles and responsibilities of the nurse in healing, and thirdly, I will talk on how a holistic nurse promotes healing and types of holistic treatment, roles of a nurse in wound healing. Finally, I will conclude my talk. After my presentation, I will provide my school email for those who might have any question. Feel free to ask. Thank you. Introduction. The nurse is an instrument of healing and a facilitator in the healing process because the nurse honors the individual's subjective experience about health belief, what people believe about their health, what they consider the cause of their illness, and ways to overcome an illness. Values, principles, or standards of behavior, one's judgment of what is important in life. Holistic nursing practice draw on nursing knowledge, theory as a possession, or a system of ideas intended to explain something, especially one based on general principles independent of the thing to be explained. Research, expertise, knowledge in a particular field like expert skill. Intuition, a thing that one knows or considers likely from instinctive feeling rather than conscious reasoning. And activity. Responsibilities of a nurse is to make a patient feel relaxed, comfortable, part of healing process. Nurses should learn patient's name, maintain eye contact, show compassion, use imagery, visual description or figurative, especially in a literary work like rating of pain, the deepness of the pain, relaxation techniques for pain control, administering medication when possible.
First, make sure this intervention is appropriate. It may be in accordance with the healthcare provider's order, for example, or you can assess for adventitious breath sounds and signs of altered oxygen saturation, including cyanotic nails, lips, mucous membranes, or skin, restlessness, and difficulty breathing.
Deep breath. Deep breath. Good, thank you. You know, I'd also like to put a pulse oximeter on you to see how much oxygen is in your blood.
Okay.
Then, select a site to place the sensor, such as the patient's earlobe, the forehead, the bridge of the nose, or a finger.
Nice and warm. That's good. Okay, and I also want to look at your feet.
Okay.
I'm going to remove your sock.
All right.
Okay, I think your hand will be the best place for the pulse oximeter.
Okay.
Avoid a finger on the same side as an electronic blood pressure cuff. And avoid any site that has edema, altered skin integrity, or hypothermia. For a finger, remove any nail polish or artificial nail with acetone or polish remover.
Check your capillary
In the
refill.
selected site, assess the capillary refill. If it's more than 3 seconds, select an alternative site. If capillary refill is less than 3 seconds, ensure that the site is free of moisture. When a patient has special needs, plan to use an ear for a patient with tremors, an ear or bridge of the nose for one with peripheral vascular disease, a disposable tape-on sensor for an active patient or obese patient, or a clip-on sensor instead of a disposable adhesive one for a patient with a latex allergy. Position the patient comfortably. If you're measuring pulse oximetry on her finger, instruct the patient to breathe normally. Then attach the sensor to the selected site, instructing the patient that the clip-on probe will feel like a clothespin on the finger, but won't hurt. Turn on the oximeter. After you get a pulse waveform and intensity display and an audible beep, assess the patient's radial pulse and compare it with the oximeter pulse rate.
So this is a pulse oximeter, and what it does is it uses light to measure how much oxygen is attached to hemoglobin in your blood. And that's going to be this top number here.
Leave the sensor in place until the oximeter reading is constant and the pulse display reaches full strength during each cardiac
And the
cycle.
bottom number is your heart rate. 60 to 100 is a normal heart rate. Now I'm just going to palpate your radial pulse and compare the heart rate I have, palpating your pulse, with the number the machine is giving me.
Then read the peripheral oxygen saturation, or SpO2, on the digital display. For continuous monitoring, adjust the alarm limits for the SpO2 and pulse rate based on the patient's condition and/or healthcare provider's orders, and verify that the alarms are preset and on.
The roles of the nurse in healing. The nurse is often the first healthcare professional a patient comes into contact with regarding medication, treatment plans, and other provisions vital to the individual's health or recovery. Virginia Henderson characterized the nurse's roles as substitutive, which the nurse does for the patient; supplementary, which is helping the patient; complementary, which is engaging with the patient to do something. As an instrument of healing, the nurse does the following: identify each patient as an individual, acknowledge the whole patient, interact with all patients and colleagues mindful and respectful, assess patients holistically through open communication, pinpoint potential contributing stress factors that impact a patient's health. How does a holistic nurse promote healing? Is also known as a complementary health nurse. This nurse uses alternative medicine to treat patients and sometimes combines the holistic healing techniques with traditional medicine. Some of alternative medicine complementary practices are mind-body medicine, meditation, relaxation, hypnosis, aromatherapy. Biological based, we have herbal medicine, homeopathy, detoxification, diet, nutrition. Body based therapy, we have naturopathy, acupressure, reflexology, and chiropractic. Energy based techniques, we have crystal healing, acupuncture, reiki healing, and yoga. Types of holistic treatment. Acupuncture is an energy based technique which involves the insertion of very thin needles through your skin at strategic points on your body. It is most common use to treat pain, and it is being used for overall wellness, including stress management. Aromatherapy is a mind-body medicine, which is the use of aromatic plant extracts and essential oils for healing and cosmetic purposes. Massage is a mind-body medicine and an energy-based therapy, which is the rubbing and kneading of muscles and joints of the body with hands, especially to relieve tension or pain. Hydrotherapy is the use of exercise in a pool as part of treatment for conditions like arthritis. Balneotherapy is a kind of treatment of disease by bathing in thermal mineral water. Hypnosis is the state in which a person seems to be asleep but can still see, hear, or respond to things said to them. Yoga is a combination of physical and mental exercise with breathing techniques and meditation to relieve stress and to relax body and mind. Therapeutic touch is the use of practice to correct or balance energy fields. Roles of a nurse in wound healing. Recognition. A nurse who recognizes the early signs of skin disruption can help keep a small problem from turning into a big one. To recognize wounds early, the nurse must understand where patients have the highest chance of developing a wound and check the area daily. Diabetics wounds. Keep blood glucose levels under tight control. Keep the ulcer clean and bandaged. Cleanse the wound daily using a wound dressing or bandage. Tell the patients not to walk barefoot. Elderly and debilitated, the nurse should have knowledge of basic home caring procedures, assist with eating and regular turning and preventing pressure ulcers.
This resident has developed a pressure ulcer. It was caused by the combination of a wrinkled pad and unrelieved pressure on the buttocks. Pressure ulcers that are not treated immediately can become infected and may even place a resident at a higher risk for death. Fortunately, most pressure ulcers are preventable.
It starts with the CNA to look at the skin and to keep up with it and notify the nurse when there's a problem.
Observation is the first line of defense to observe a patient.
As a nurse aide, you play an important role in helping to prevent pressure ulcers before they occur. Nursing homes that fail to provide the care that's necessary to prevent or treat pressure ulcers can receive survey deficiencies and fines. If negligence is determined, a facility may face litigation that can cost millions of dollars.
The CNA has the most important role in preventing pressure ulcers or detecting early pressure ulcers. All the patients in long-term care units or long-term medical intervention units are at high risk for skin breakdown because of immobility, incontinence, the inability to feel sensations, the inability to move themselves in the bed. Certain drugs that they have to take make them more immobile or unable to move themselves.
Prevention. Some wounds like surgical insertion are inevitable, but complications such as infections are not. To prevent wounds, the nurse must provide good nursing care for pressure ulcers, decrease wound complication, frequently turn patients and examine common wound sites such as the back and the hip bone. Scruples, handling and care of wounds help to prevent contamination and possible infection. Education, always a big part of nursing care, teaches patients and families on how to avoid complications and possible infection. Treatment. No wounds should be considered too small to treat. Ignoring small wounds allow to turn into larger and potential life-threatening wounds. Once an open wound develops, a nurse must 1. Follow a physician's order for treatment. Document every wound in detail, size, color, depth, stage, and drainage. Make sure the physician is aware of the injury and has instituted a plan of care for treatment. In conclusion, the goal of a nurse is to improve patients' care. More often is the first-line health care professional a patient may contact with regard to medication, treatment plans, provisions important for the individual's health or healing. The nurse recognizes and integrates the principles and modalities of healing into daily life and clinical practice. Thank you very much for listening, and I will be very much happy and glad to answer any question which may arise from you.